as we just come up on the top of the hour here. Hospitals across the country are being pushed to the brink. They're becoming overwhelmed as they deal with an influx in patients with COVID, the flu, and RSV, along with persistent staffing shortages. Some hospitals have had to set up overflow tents and activate transfer agreements with nearby facilities to manage the surge in patients. The Washington Post notes of the staffing issues, quote, more than 500,000 people in the healthcare and social services sector quit their positions in September, evidence in part of burnout associated with the coronavirus pandemic. And the American Medical Association says 1 in 5 doctors plan on leaving the field within 2 years. Let's bring in NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, it is so great to see you always. We appreciate you being here and up early with us. Boy, these are medical professionals who are the heroes of the pandemic, have been through so much over the last nearly 3 years now, and being asked again to deal with these extraordinary conditions, adding flu and RSV now into the equation. How bad is it in hospitals across the country?
Willie, good morning. Great to see you. Yeah, I'm sitting in an adult ICU right now here in Seattle, not far from our children's hospitals. And I'll say that in children's hospitals, it's a lot worse. An adult hospital capacity right now it isn't quite as bad as it was back in the winter of 2020, 2021. But it's important for your viewers to understand that slack in the system in children's hospitals is by definition always pretty low. 1/10 the hospital capacity for kids versus adults. Really what we're seeing across the country with children's hospitals is that there isn't any slack in the system. It's completely packed. And there are a lot of reasons for that. But basically, across the country, since the beginning of the pandemic, we've seen a 20% decline in the amount of pediatric beds for a variety of reasons. But basically, pediatric beds have been closing preferentially. And now we're seeing this RSV surge that this is really coming to a head.
So, Dr. Gupta, my son got sick a couple weeks ago, went in, and they just immediately tested him for all 3 of those that you've just laid out. So explain, if you can, a little bit RSV, which I think is probably new to a lot of people, and how serious that can be.
So this is another contagious respiratory virus. Can cause the common colds, Willie, and folks like you and I, and most adults, it'll just cause the common cold. If you're high risk, medically high risk, over 65, or if you have, say, a really high-risk medical condition like cancer, it can land you in the hospital with severe pneumonia. Critically, for parents out there with young babies, what this can do is, and the difference between this flu and COVID, they're great mimickers of each other. RSV can cause high-pitched wheezing. So if you put your ear next to your baby, if they're, say, sniffling, and you hear some high-pitched wheezing, almost, I can't say it's a guarantee, but high likelihood RSV. If you see their nostrils flaring out, another key sign. Chest retractions, their rib literally sucking in, another sign potentially that they're dealing with RSV. Really, flu, again, none of these things are definitive 100% signs of a diagnosis, but flu, high fevers, COVID often causes non-pulmonary symptoms, GI issues, and brain fog. So a quick toolkit, frankly, to understand what might be actually happening, since we don't have at-home tests that test for RSV, COVID, and flu at the same time.
So, Dr. Gupta, now we're just at the beginning, really. If you look at it, of the holiday season, people are going to be gathering again, and Thanksgiving, and coming up through Hanukkah and Christmas and all the other holidays that come with it. So what should people know? Do you want them to get their flu shot now? Is it too late to get your flu shot? Should they get that COVID booster? What's a good way to prepare for what's ahead here through the winter?
Perfect time to get your additional shot here. If you're medically high risk, remember to ask your medical provider for the quadrivalent flu shot. Ask them for the stronger flu shot. If you don't remember the word quadrivalent, stronger flu shot for medically high risk. Still within the window. And it's still okay to space out the booster shot and the flu shot. You can get them at the same time. No increase in adverse reactions. That's a common question we get. Willie, something critical here that we don't talk enough about in the medical profession, in my opinion. If you're medically higher risk and you're traveling and you're worried, maybe you'll test positive for COVID or, say, flu, something you should do, talk to your medical provider, ask them if they'll place a standing prescription for Tamiflu or Paxlovid. Tamiflu treats flu fairly well. Paxlovid treats COVID fairly well if started early. Standing prescriptions, though, are key. So then you already have it in the pharmacy. You just have to go fill it. so you don't have to go racing around if you test positive and are feeling ill. So standing order is something, if you're medically high risk, I encourage all of your viewers to do, and that's really important. Lastly, Willie, I'll just say this RSV surge is necessitating us to develop at-home tests for more things than just COVID, because coughing can mean more than just COVID. So COVID, flu, RSV, tests that can do tests for all three in the at-home environment, really critical for the future.
Dr. Vin Gupta, great advice, and always appreciate you stopping on another busy day for you. Thanks so much. Good to see you.